Nu-Derm Tolereen Lotion is a medication that is used to treat a variety of skin conditions, such as insect bites, poison oak/ivy, eczema, dermatitis, allergies, rash, itching of the outer female genitals, and anal itching. It contains hydrocortisone, which helps reduce swelling, itching, and redness that can occur in these types of conditions. It is considered a mild corticosteroid. When using Nu-Derm Tolereen Lotion, it is important to follow the instructions carefully. This medication is meant for use on the skin only, and should not be used on the face or underarms unless directed by your doctor. If using the lotion or foam, shake it well before applying, and if using the spray, check the product package for instructions. Before applying the medication, make sure to wash and dry your hands, as well as clean and dry the affected area. Apply a small amount of the medication to the affected area and gently rub it in, up to 4 times a day or as directed by your doctor. The dosage and length of treatment will depend on the specific condition being treated. After applying the medication, be sure to wash your hands, unless they are the area being treated. It's important to avoid getting the medication in the eyes, nose, or mouth, and to rinse with plenty of water if this happens. If irritation occurs or continues, contact your doctor immediately. This medication should only be used for the condition for which it was prescribed, and should not be used for longer than directed by the product package or your doctor. If your condition lasts or worsens after 7 days, or if you think you may have a serious medical problem, be sure to contact your doctor. Some common side effects of Nu-Derm Tolereen Lotion may include stinging, burning, irritation, dryness, or redness at the application site. You may also experience acne, unusual hair growth, small red bumps on the skin, folliculitis, skin thinning/discoloration, or stretch marks. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they've determined that the benefit to you outweighs the potential risks of side effects. Many people using this medication do not experience serious side effects. If the treated area starts to bleed, especially if you are using this product for anal itching, it's crucial to contact your doctor immediately. While rare, a very serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, be sure to contact your doctor or pharmacist for further guidance. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Nu-Derm Tolereen Lotion, it's important to talk to your doctor or pharmacist if you have any allergies to hydrocortisone or other corticosteroids. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to consult with your pharmacist for more details. If you have any health problems, make sure to consult your doctor or pharmacist before using this product. Additionally, if you have itching of the outer female genitals with vaginal discharge, it's important to consult your doctor before using Nu-Derm Tolereen Lotion. Do not use this lotion if there is an infection or sore in the area to be treated, as skin infections can become worse when using this medication. It's important to inform your doctor if redness, swelling, or irritation does not improve. For children, they may be more sensitive to the effects of too much corticosteroid medication, so consulting your doctor for more details is necessary. During pregnancy, it's important to use this medication only when clearly needed, and discussing the risks and benefits with your doctor is essential. Additionally, it's unknown if this drug passes into breast milk when applied to the skin, so consulting your doctor before breastfeeding is important. When using Nu-Derm Tolereen Lotion, it's important to be aware of potential drug interactions that could affect the effectiveness of your medications or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contacting a poison control center right away is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember, it is important not to share this medication with others. If your doctor has prescribed this medication for you, make sure to only use it for your current condition and not for other skin problems unless instructed otherwise by your doctor. In those cases, a different medication may be needed. It is also important to keep all medical and lab appointments. If you forget to use Nu-Derm Tolereen Lotion at the scheduled time, use it as soon as you remember. However, if it is close to the time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. Make sure to check the storage information on the package and keep the Nu-Derm Tolereen Lotion away from light and moisture. If you have any questions about storage, you can always ask your pharmacist for advice. Remember to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the lotion when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.